I'm hearing a little bit more about prehabilitation. Can you talk to us about that in general and specifically in the cancer world, how that applies?
Yeah, this prehabilitation is it's a well discussed and well liked topic, among rehabilitation providers, including PM&R physicians. And the idea is that the stronger you make somebody going into an event or something that may lessen their function, the easier time they'll have during that treatment or during their recovery. And so there's been studies largely in surgical populations for cancer, so colorectal, bladder, lung, that showed that if people exercise before surgery, they end up, recovering quicker, less length of stay in the hospital, they walk longer. A lot of the research has been in if people walk more before surgery, they walk more after surgery and quicker. There's been some breakthroughs, like with one lung cancer study found that patients who were too weak to have surgery to resect their lung cancer after prehabilitation were statistically likely to be able to then get surgery, which could be curative, which is really great.
Mm-hmm.
A lot of it, though, again, is if you walk during your chemotherapy for colorectal cancer, you're going to walk more quickly. What we need, I think, is this next level of can we empower patients with this is a home exercise regimen, this is what you do in like a 1 or 2 time visit, because they've researched, like I said, colorectal cancer where patients might be on chemotherapy for months before surgery.
Mm-hmm.
Lung cancer where maybe they can't have the surgery, so you have this time to prehabilitate. Where I struggle is in 2 ways. One is I'm not so sure if a physiatrist needs to see a patient to say, go walk, right? That's something a nurse, physical therapist, exercise physiologist, lots of people can do and do as well as I can. So it's cheaper and easier and faster for patients to get into those specialties. I do think there's a value in PM&R seeing some of these patients, because the other issue with Prehab for me is most of these cancers, a lot of them, the treatment happens really quick. You're not going to sit and watch somebody with breast cancer with a tumor that needs to be taken out for 6 weeks while they walk more, right? That makes no sense. Brain tumor, etc. So is there a way to sort of target a program, a regimen you can give someone? This is what you do for the 4 days before surgery. This is what you do day 1 post-op. This, and this. Set up a visit maybe with a PM&R physician. Okay, you have nerve pain and you can't position your arm for radiation. Let's block that. Things that are actionable, but don't require this really long length of time. I think that's the next frontier, because we pretty well solved, moving is good.
Mm-hmm.
We need to, I think, take that next step.
When you said that, it almost reminded me of when, right before surgery or anything like that, how they call you and say, like, don't forget to shower with HiPoCleanse. Don't forget to, like, wash yourself with all these specialty soaps and pick it up. And it kind of reminded me of, even that short reminder, like, here are the functions I want you to do. These are the exercises I want you to do before your surgery, could be as simple and easy as that on the lighter end, too.